Welcome back to our discussion about healthcare planning during incapacity. Healthcare planning uses a lot of terms that sound similar to each other. Terms like living will, advanced directive, healthcare proxy, power of attorney. People often nod along, thinking they understand, until they're asked a simple question like, what does each do? Or, which documents do I need? That's what this unit is for. By the end of this unit, you should be able to explain the terms and what each document does, understand how they work together, and know how to structure your healthcare decisions. In this lesson, we are focusing now on why having documents in place is important, and what happens when medical decisions need to happen fast, sometimes in the time it takes for a doctor to walk from an operating room to a waiting room. Imagine you are scheduled for a routine surgery. You've talked to your spouse or your kids, and they know what you want. You're wheeled into the room, the anesthesia takes hold, and you're no longer able to speak. Suddenly, the surgeon discovers a complication. It's not life-threatening this second, but it needs to be addressed now to avoid a second surgery later. The surgeon steps out to find your family. A yes or a no is required to decide how to move forward. In that moment, your family may be under immense stress. Without a written plan, they are left guessing what is best and what you would want. This is where the reality of medical decision-making hits home. Verbal wishes, as well-intentioned as they are, often fail in a crisis. Why? For several reasons. Family members may remember the same conversation differently, details blur, and in high-pressure medical situations, medical personnel may not be able to rely on second-hand recollections alone. Hospitals and doctors operate under strict legal and ethical standards. If your preferences aren't documented in writing, medical teams are generally required to follow default protocols designed to preserve life. That may mean pursuing aggressive treatment, even if it doesn't reflect what you would have chosen, simply because there is no legally recognized instruction directing them otherwise. These fast moments happen more often than we think. It's not just sudden accidents. It could be the ICU team needing to know if they should start a ventilator during a severe bout of pneumonia. It could be a sudden stroke that leaves you unable to communicate for a few days. It could even be the slow, quiet progression of dementia, where the big decisions about where you live or who can visit you start to pile up. When there's no clear written roadmap, conflicts can occur. Imagine two siblings standing at a father's bedside. One remembers a casual comment from 5 years ago that, if it ever gets to the point where it's just machines and misery, please let me go. The other remembers dad saying he wanted everything done to see his grandkids graduate. Both desire to act out of love. But if there is no written advance directive, what path should they choose? Here is the perspective shift for today. Creating a medical plan isn't about planning for death. It is about defining your quality of life. It is about deciding what a good day looks like to you. For some, a good day means being home, even if it means a shorter life. For others, it means staying alive at all costs, hoping for a medical breakthrough. So, if you aren't able to communicate your decision, what path should be chosen? In these moments, people often rely on verbal wishes. Things like, they wouldn't want that, or we talked about this once. The problem isn't that those conversations don't matter. They do. The problem is that stress changes everything. Under stress, memories blur. People hear things differently. Family members remember different versions of the same conversation. And without something concrete to anchor decisions, uncertainty can take over. Add in fear, exhaustion, and time pressure. And even the most well-meaning families can struggle. Medical teams look for guidance. They ask questions like, what would this person want? Or, what matters most to them? Clear values make those questions easier to answer. And here's the key shift for this unit. Healthcare planning isn't about predicting every possible medical situation. It's about giving your future decision maker a compass, a way to orient decisions when there's no perfect answer. That compass starts with values. Some people prioritize comfort over longevity. Some prioritize time, even if quality is uncertain. Some prioritize independence or being at home. Some prioritize flexibility and want decisions made case by case. Many people fall somewhere in between. In future lessons, we'll discuss more about what role your healthcare agent fulfills and how to help them navigate different medical decisions. By watching this video today, you are taking the first step to making these moments a little easier for your family. If you're ready for a small, immediate step, I invite you to think about your top 3 care priorities. You don't need to know the names of medical procedures yet. Just ask yourself, what matters most? Is it being free from pain? Is it being at home? Is it having your family nearby? Or is it independence and the ability to recognize your loved ones? Complete the questions below this video, and if you would like to explore this topic further, check out the additional resources. You're doing great. Let's keep building this medical roadmap together.